let's be honest, trying to get a handle on complex topics, especially something as, well, as vital as healthcare, can feel like finding your way through a maze, right? All that jargon, the paperwork.
Oh, absolutely. It's like you're navigating this huge system, all these appointments, reports, prescriptions.
Yeah, and there are these massive unseen systems working behind the scenes. It's just, it's a lot to keep straight.
It really is. You're focused on your health, obviously, but you're also dealing with this incredibly intricate structure, information overload.
Yeah.
It's just part of the deal, it seems.
Totally. And that's, exactly why we do these deep dives. We take a whole bunch of materials like the ones you share for today, and we try to pull out the really crucial bit.
Essential insights.
Exactly.
Yeah.
The goal is to give you that shortcut,
Right.
cut through the noise and get to what really matters for being informed.
So today we're looking at insights from sources covering, two key areas. They might seem separate at first glance, but they're actually very connected. First, we'll look at how the organizations themselves, the hospitals and clinics, work to build in quality and patient safety. Think formal processes,
Right.
like accreditation.
Right. The system side. And then
we shift gears to the personal level. Practical strategies for you as a patient, especially when you're talking to those highly specialized doctors, how to navigate that conversation.
Gotcha. So we've got info on the big accreditation bodies, global and national examples.
Yeah, like in India.
Yeah.
And details on consultancy services that actually help hospitals get accredited. And then on the other side, specific tips for patients talking with specialists.
Okay. So the mission is to connect these dots, see the big picture, see the personal picture, and hopefully give you some useful, practical knowledge. All right, let's unpack this.
Let's start with that organizational piece then. How healthcare providers tackle quality and safety from a systems perspective. A really big part of that, based on the material, seems to be these accreditation bodies.
And the sources mention Joint Commission International, JCI. Sounds like they're a pretty major player globally in this, focused specifically on quality and patient safety.
That's right. The material really highlights JCI's mission, which is basically to enable and confirm the highest possible standards of healthcare quality and patient safety for everyone.
And they're big.
Their reach is pretty impressive, yeah. The sources say operating in over 70 countries, more than 1,000 accredited or certified programs worldwide, supported by like 600 plus experts.
Okay, so they're widespread, but what do they do exactly? It's got to be more than just handing out badges, right?
Definitely more. They develop these international standards. That's kind of the foundation. Then they have accreditation programs for hospitals, clinics, that sort of thing, and certification programs for really specific areas. The sources mention things like clinical care programs, healthcare sustainability, even telehealth certification now, plus training and advisory services to help organizations actually meet those standards.
So the standards are the key, like the yardstick they use.
Precisely. They're the foundation for evaluation, for measuring how well an organization is doing, assessing it, and then hopefully improving performance over time.
And they mention specific goals, too, international patient safety goals.
Yes, and that seems really important. They're specific objectives designed to help hospitals focus on, the really common problem areas where patient safety can be at risk.
Like what sort of things?
Well, think about standardizing how they handle medications to avoid errors, or improving safety during surgeries, stuff like that. Critical areas.
And going through this whole accreditation process, it seems like it really pushes hospitals to improve internally. The sources mentioned testimonials talking about better staff training, improved teamwork.
Absolutely. Better communication within the hospital, too. Other benefits they list are things like getting a competitive advantage, maybe.
Makes sense.
Building more trust in the community about the quality and safety of care they provide. Also, improving how they manage risks, reducing potential problems, and really crucially, creating a whole culture that's focused on patient safety.
It sounds like it's all driving towards that big vision JCI has, which the sources said was zero harm and highly reliable care. That's ambitious.
Very ambitious, yes.
Yeah.
And look, while JCI is a global example, this kind of effort isn't just international. We see national bodies doing similar work. The material pointed to the National Accreditation Board for Hospitals and Healthcare Providers, NABH in India, for instance.
Right, NABH. Part of the Quality Council of India, setting up accreditations specifically for Indian healthcare organizations.
Exactly. And their aim is very much focused on, meeting the needs of patients in India, setting high benchmarks for the health industry there. They work with everyone, industry, consumers, government, but they operate independently. It's about raising that national standard.
Okay, but getting accredited, whether it's JCI or NABH, sounds like a huge project for a hospital, a massive undertaking.
Well, for sure.
And that's where those consultancy services come in. Supremedic Consultancy was mentioned, helping with NABH implementation, that kind of thing.
Yeah. Right. And these consultants, they often provide really comprehensive support. I mean, everything from the initial planning, like facility design, even helping with hiring staff.
Wow.
Selecting the right equipment, and then actually implementing the quality management systems needed to meet the standards. Their whole goal is helping the hospital achieve accreditation and embed those best practices.
Yeah.
Which, should lead to better care for patients.
Okay, so that covers the big picture. The organizations, the standards, the support systems helping hospitals get there. But let's zoom right in now, away from the systems and policies to your experience as a patient, particularly when you're sitting across from one of those really specialized doctors.
Yeah, this is where it gets very real, doesn't it? Where the system directly interacts with you. We're talking about what the sources call superspecialists.
Superspecialists. So
these are doctors with, incredibly deep expertise, often in a very narrow field, complex conditions, specific organs. Think cardiologists dealing only with heart rhythms, or neurosurgeons focused on one type of brain surgery. That level of focus.
And the material is pretty clear. While you absolutely need their expertise, talking to them can sometimes be challenging for patients.
It can be, yeah. And it's not necessarily that anyone's trying to be difficult. It's just the nature of that high-level knowledge gap.
How so? What are the common issues?
Well, the sources point out a few things. One is the jargon. Super specialists often use technical medical terms, coronary artery bypass grafting, valvular heart disease, stuff that's everyday language for them, but sounds like, well, Greek to most of us.
Right. And they might talk fast, maybe under pressure.
Exactly. Time constraints are real.
Yeah.
Or they might just assume you have a certain level of medical understanding that you probably don't.
Plus, these appointments can be really short. The information is super specific. Maybe the treatment plan has multiple steps. And you're probably feeling stressed or worried anyway because of why you're there.
All of that together makes it absolutely vital that you walk out of that room actually understanding what was discussed, making informed decisions, following the right treatment path. It all hinges on clarity.
This is where it gets really practical then, because the sources didn't just describe the problem, they offered a whole bunch of concrete strategies you can use, things you can actually do to make sure you understand.
Yes, a really helpful toolkit. And they suggest a structured approach. First, and maybe the most important step, prepare before the visit.
Okay, so don't just show up.
Right. Actively prepare, gather all your relevant stuff beforehand, test results, old prescriptions, any scans you've had, bring it all.
And writing things down seems crucial too, like questions, symptoms.
Absolutely key. Write down your symptoms, specific worries you have, and any questions that are on your mind before you go in. Also, list all the medicines you're taking, any past surgeries, allergies, important family medical history. Doing that prep helps you use that limited appointment time effectively.
Makes sense. What else?
Another big recommendation, bring a support person, a friend, a relative, someone you trust.
Like a second pair of ears?
Exactly. The source literally says 2 sets of ears are better than 1. They can help listen, maybe take notes, so you can focus, ask questions you might forget, and honestly, just provide some comfort. It can be really overwhelming.
Yeah, I can see that. It's hard to take everything in when you're maybe feeling anxious or hearing difficult news.
For sure. And then, during the appointment, the sources strongly encourage you to ask for simple explanations.
So don't be shy about saying, I don't understand.
Not at all. Politely interrupt if you need to. Ask them to explain technical terms in plain language.
Yeah.
Ask, could you draw a quick picture of that? Or what does that test result actually mean for my day-to-day life? Doctors usually appreciate you being engaged and trying to grasp it.
So it's okay to ask them to, slow down or explain it really simply.
It's more than okay. It's necessary for good care. And related to that, make sure you clarify before leaving.
Like a final check.
Yeah, use a checklist approach in your head or even on paper. Before you walk out, ask specifically, okay, what is the diagnosis again? Why do I need these specific tests? When should I get them? What exactly do these medications do? What are the side effects I should watch for? If they mentioned a procedure, what are the risks and benefits? And maybe most important, what are the next steps for me after I leave here today?
That avoids that feeling of getting outside and thinking, wait, what was I supposed to do next?
Precisely. And to help with remembering all this, request a written summary.
Oh, good idea. Like actual notes?
Yeah, ask for printed visit notes, discharge instructions, it's applicable, clear prescriptions, maybe even those diagrams they drew. Having something physical to take home and review later or share with family is incredibly helpful.
And technology can help too, right? We all have phones.
Definitely. The sources suggest things like looking into medical apps that might help translate jargon, or just using online medical dictionaries when you get home to look up terms you heard. Even using telemedicine for follow-up questions might be an option sometimes.
Okay. And what about if you're still unsure? Or if it's a really major diagnosis?
Then the sources are very clear. It is always okay to seek a second opinion, especially for complex conditions or high-stakes decisions. You have every right to feel confident, and actually, many super specialists encourage it. They want you to feel sure, too.
That's reassuring. It sounds like there are lots of tools.
There are. And beyond those main strategies, the material also mentions other helpful things, like practicing active listening, maybe repeating back what you think you heard.
So what you're saying is kind of thing.
Exactly. Using any visual aids the doctor offers, trying to engage in shared decision-making where possible, paying attention to nonverbal cues, asking for patient education materials involving loved ones.
It's a whole approach.
It is. And they also flag common mistakes to avoid, like just nodding along politely when you're totally lost.
Guilty.
We've all done it. Or waiting until after the visit to think of questions, leaving without knowing the next step, or comparing your situation too much to someone else's story you heard online. Every case is different.
And there are things to do after the visit, too.
Yeah, simple things like reviewing the notes you took or were given, calling the office with follow-up questions if needed, maybe looking into patient support groups for your condition, or seeing if the hospital has resources like patient navigators or helplines.
Wow. Okay, the core message seems to be the doctor's the expert on the medicine, but you're the expert on you.
That's a great way to put it. The super specialist knows their field inside out, yes, but you know your body, your life, what you're feeling, what you can handle. Understanding isn't optional. It's essential for your health and safety. You have the right to take the time and ask for that clarity.
Okay, so let's connect the dots then. We've talked about the big picture, these large organizations, accreditation bodies like JCI and NABH, setting standards for quality and safety, systemic stuff.
Right.
We've talked about the very personal level, you in the room with a specialist, trying to understand complex information, using specific strategies. How do these two levels, how do they actually link up?
Well, I think they're fundamentally two sides of the same coin, really. Both are aiming for better, safer healthcare outcomes.
How so?
Think about it. The accreditation standards, like those patient safety goals from JCI we mentioned, a huge part of patient safety comes down to communication, doesn't it?
Yeah, absolutely. If you don't understand your diagnosis or how to take your medicine or what the risks of surgery are, that's a safety issue right there, no matter how good the hospital system should be.
Exactly.
Yeah.
So while the sources didn't maybe give us a direct quote from a standard saying, "Thou shalt communicate clearly," the whole goal of accreditation, creating that culture of patient safety, inherently has to include effective communication. Between doctors and nurses, yes, but critically, between providers and patients.
It has to be baked in somehow.
It seems logical, yes. And look at those consultancy firms, like Supreme Medic. They help hospitals get accredited by implementing best practices. The fact that their materials also talk about strategies for better patient-specialist communication, well, that strongly suggests the industry sees this connection too. Improving patient understanding is part of achieving that overall quality and safety standard they're aiming for with accreditation.
So getting the big systems right through accreditation and empowering individual patients to understand their care, they work together.
They're mutually reinforcing. You need the systems driving for high quality and safety, and you need clear communication at the point of care to actually deliver on that promise safely. Organizational excellence and individual understanding go hand in hand.
Okay, so this deep dive, it's really shown us that improving healthcare isn't just one thing. It's happening at these multiple levels all at once, from global bodies setting standards for hospitals down to that really crucial, maybe sometimes difficult conversation between you and your doctor.
And hopefully, by understanding a bit about how organizations are pushing for quality through things like accreditation, and maybe more directly useful, by actually using some of those communication strategies we talked about, you can navigate the system better, feel more empowered in your own healthcare journey.
Definitely gives you more agency. And it makes you think, doesn't it, when you hear about a vision like JCI's zero harm in healthcare. That's such a huge goal.
Immense.
How much does the patient's own active role, making sure that communication is clear, actually contribute to turning that massive vision into something real?
That is a significant question to ponder, isn't it? Something
Yeah.
to think about until our next deep dive.